Thank you for tuning into NorthPoint Making Health Happen. My name is Biftu and I'm your host. This is a new series brought to you by NorthPoint Health and Wellness Center. We want to connect with you about topics in health and wellness that impact our community. We will feature guests from our team and around the community to talk about the health and wellness issues most important to North Minneapolis. Together with our guests, our community, and you, our listeners, we are partnering to create a healthier community. Today, we are joined by Zadok Nampala, an independent, licensed, experienced, and dedicated therapist with a master's degree in social work and a bachelor's degree in psychology. He has recent experience using his fluent Spanish to help NAFTA beneficiaries from Canada and Mexico and other parts of the world transition to working in the United States. Z also provides medical consultation for Swahili and tribal Africans in the United States. He has proven success teaching in face-to-face and virtual classrooms as a college instructor. And like many naturalized Americans, he has a deep love for this country and a passion for its social challenges, as reflected by his work with the ACLU and the Civil Rights Commission. So, thank you to Zadok Nampala for joining us. Today, we're going to be talking about children's mental health. And like I said in the introduction, Z, you have a lot of experience and education in this topic. So we're really grateful to have you here to answer our questions. So welcome.
Yeah, I'm grateful to be here, Biftu. Thank you so much.
Fantastic. So like I said, we're talking about children's mental health specifically. And we're just going to dive into our questions. Can you give us a little bit of an overview on what children's mental health is?
Yeah. Well, first of all, I want to thank you, Biftu, and I want to thank NorthPoint Health and Wellness in conjunction with Inc. For providing this opportunity for our community members and people at large to learn more about what we do at NorthPoint and also just for the health of the people in our community. I really appreciate the efforts that that NorthPoint has been doing for the past 55 years. And this is showing that we really have our people in our hearts. When it comes to children's mental health, this is a very important topic and one of the topics that recently has started getting a lot of focus because of how the pandemic and many other things in our society has led us to have our children at home more instead of being in school. And so when we talk about children's mental health, this basically refers to developmental and emotional milestones and learning healthy social skills that children have that equips them to cope with problems when they arise. When you have a mentally healthy child, this child would have these positive qualities that would help them function well at home, in school, and in the community. These are children who will socialize well. These are children who will experience friendships, and they will grow also to become responsible people. And so mental health is very, very important, especially in the early ages of a child, because this determines how they progress in life.
Okay, thank you. Let's talk about what are the most common childhood mental disorders that we might see. Can you tell us?
Yeah, so when it comes to some of the common childhood mental health uh, diagnosis that we see, ADHD is one of the most commonly diagnosed um, child mental health disorder. And I think sometimes this is a misdiagnosis, but that's a topic for another day. But that's one of the common ones that you see. We have anxiety, which is basically fears and worries, and then we have depression, post traumatic stress disorder, which can be caused by a lot of things. Is also one of the common ones that's being diagnosed in children. We also have behavior disorders, which include things like oppositional defiance disorder and also conduct disorder. Now, one thing that I like to point out is that many a times when children experience different changes in their lives, that can also bring by certain kind of behaviors and needs that are normally not seen. Um, Essentially, we call this adjustment disorders. And so when you have a child, maybe you move to a new school, a child can start portraying some or exhibiting some kind of symptoms that normally they don't. And this would be because of the move. Or if you have a family going through separation, or a newborn child, you will see certain behaviors that uh, might be there for a little while, but because this child maybe is moving to a new environment and meet people who don't necessarily know them, they might think that they have certain conditions. And so, as a therapist, I usually start in the lowest form of diagnosis, which will be adjustment, looking at the environment and the changes that have happened. And then, so I would have maybe adjustment disorder mixed with anxiety, adjustment disorder mixed with a little bit of depression, adjustment disorder with a little bit of conduct, and all these things are just on the minimum, and then you observe them as you go by. So these are just basically some of the commonly diagnosed disorders in children.
Okay, thank you.
Mhm.
Let's talk about how common it is for children to be living with a mental disorder, whether it's diagnosed or not. How common is that?
It's very common. It's really common. In the United States, I think according to the U.S. Surgeon General, they say that in about 20% of U.S. children suffer from one form of mental illness or another, and approximately 5 million children in the United States, um, uh, are suffering from a serious mental illness that can considerably increase their can really affect their normal daily functionings. These numbers have actually changed quite dramatically since we had COVID, pandemic, and other things that have happened in the recent past that have really exaggerated the numbers. So the numbers are pretty high right now. I think the statistics was done maybe in 2017, but the numbers have gone pretty high. So there's a lot of children that are experiencing one form of mental disorder or another, or stresses basically that result to mental disorder.
Okay.
Mhm.
Um, so let's say you are a parent or a guardian, and you might be worried that your child um, has a mental disorder
Mhm.
or is maybe exhibiting certain behaviors. So tell us about what symptoms to look out for in a child.
Yeah. So as a parent or a guardian, um, you will notice some things, and it's also important to also be vigilant and just be keen, because sometimes these things are very subtle that you won't even notice. And
Mhm.
so sudden change in school performance despite hard work. If your child has been performing really really well and then all of a sudden the performance drops, they start really not doing well in school, that could be a sign that there's something going on. um, you need to check on that and see what's going on. Also, you could see that unexpected weight loss,
Okay.
difficulty concentrating, and some of these things could be detected when you go to see their primary care provider. So when you go see their primary care provider and they say, "Wow, has James had any sudden, drop in weight?" and they measure the weight and they see that, "Oh wow, he's dropped." Um, that could be a sign of a mental disorder. Or something going on with that regard. Unreasonable or frequent complaints about headache and stomach aches that are not explained. They might be going through some stresses, and so that also comes in as a form of physical nature. So you want to look into that. That's another sign. And then if you see that they have a frequent temper and tantrums or outbursts of anger, these are things that really could tell the telltale signs that there might be something behind those that are being defined with those behaviors. Hyperactivity. Okay,
Mhm.
that's a common one too. So your child is usually very calm, and then all of a sudden they have hyperactivity, unable to cope with normal daily problems and activities. So they're struggling with things that they otherwise don't struggle. That things that they function normally, they're struggling with that. You need to look at that now. As a parent, I talk to my children on a daily basis when they come home. I ask them how was their day. I check
Mhm.
in with them, and by doing that, if I see anything that's out of the odds, then I inquire some more. Sometimes they might come home, they experience a bully. And if this is prolonged, that might end up causing some kind of mental disorder, or also might lead to children portraying signs of mental disorders. And so you want to make sure you're checking in on a regular basis. And this is just, it's really important for us as parents and caregivers to really be connected and in tune with our children so that they can feel
Mhm.
secure to talk to us. that secure attachment would really help you see these telltale signs and know when something is out of odds.
Absolutely. Yes. Um, so let's talk about treatment, and
Mhm.
this is something that you obviously do at a daily basis. Can you tell us about uh, specifically in children and mental health disorders? How would you
Mhm.
go about treating that?
Yes. So when it comes to treatment, you know, not everybody. Um, I mean, let's just even go back and talk about adults and how they
Mhm.
approach treatment, right? So we still have significant amount of significant amount of stigma that is associated with receiving mental health care, right?
Mhm.
So if people are going to a therapist, people still, I mean, we're becoming more and more open to it, okay?
Mhm.
But treatment to mental health disorders has been shunned, and a lot of people have been struggling in darkness, let alone children. And
Mhm.
so, not very many people want to take their child to a so-called shrink. Um,
Mhm.
it's proven time and again that therapy and other forms of treatment really do work. Now, when it comes to treatment for childhood um, mental health disorders, we do have a psychotherapy, um, which is also referred to as talk therapy or behavioral therapy. This is when a therapist addresses child mental health concerns by talking to them, and through this, you learn about their feelings, their thoughts, and their behaviors, and you get an insight to how they can respond to difficult situations. So this is just talking, and that's what I do at NorthPoint Health and Wellness. Is right now as a therapist, I'm actually situated in a school, and I work with
Mhm.
middle schoolers, and so we talk. And you will be surprised at how amazing the children respond to when they're given attention with an adult who cares and who really shows that they want to know about them. So this talk therapy is very, very effective. It really does work. Talk therapy can also be incorporated with things like play therapy. Okay, we
Mhm.
have music therapy, we have art therapy. There are
Mhm.
all other creative ways of doing psychotherapy that can be incorporated. So you will hear people say, "Yeah, they're doing talk therapy, they're doing, art therapy, or even animal therapy." Okay,
Oh, sure.
and all these are incorporated with talk therapy. So there are so many options out there, and one of the things that have made it success for me working with children and their families is I look at it as a support for your child.
Mhm.
So when I come in from that perspective, they're like, "Yeah, I want to talk. I want to talk," and we have a good time. The introduction part of it, we don't go deep the first few days. We just start by talking about their interests, things that make them happy, things that tick them
Mhm.
off, and such. And so after a while, you find that a child really develops that connection. And then you can start going deeper and see really what are the things that are making them not have the ability to cope with social situations better. Why are they having anxiety? Why are they having depression? Why do they feel like their friends don't like them? And things of that
Mhm.
nature. And so talk therapy is one of the best therapy forms that we have, and it's less invasive. And this can I would recommend this to any child. Your child doesn't really
Mhm.
to be portraying signs of mental disorders or any signs and telltales before you do this. I would just say, there are therapists in your school, talk to them,
Mhm.
engage with them, and you will be surprised at how good talk therapy helps your child and uncover things that it also equips them with knowledge and skills to just face off. So, say if there's a bully, if they want to intervene, how do they do such things?
Mhm.
The other form of therapy is medication.
Right.
Medication is the last resort for me personally, but there is um, medications that include medication for anxiety, stimulants, antidepressive, antipsychotic medications, and mood stabilizers that sometimes have to be used um,
Mhm.
because you've tried talk therapy and psychotherapy and they really hasn't been fruitful. Now, some of these medications, or most of them, need to be used together with psychotherapy. If you come to North Point, for instance, you
Mhm.
will not just be seeing a psychiatrist and receive medication, even if you're an adult, without receiving psychotherapy. So those both
Mhm.
go hand in hand because you can't just replace psychotherapy with medication and that's it. No, you need to use both. And then eventually, some people get out of their medications and just continue their lives using psychotherapy. But some people unfortunately will have to use medications for a very long time. So those are some of the ways that
Sure.
we treatment for children with mental health disorders.
Okay, thank you. And you touched on this a little bit, so let's talk about the impact of a mental health disorder diagnosis on children. Um, what is that overall impact on their life?
Yeah, so when we talk about some of the impacts, we know this is basically we see a lot of delays and disruption of development, um, age appropriate thinking and behaviors and social skills, regulation of emotions. We will see a child really having inability to do these things that I just mentioned. When they get angry, they get absolutely outraged. And sometimes it's not even something that is that of a big of a deal, but they really become outraged. When a child is denied something, they for them they take it personal. They cannot stay in a structure. Okay, so when they go to school, they really have no structure. They find it really hard to focus.
Mm-hmm.
These are some of the impacts that come in with that. The social skills are very, very important because if you don't have or don't possess good social skills, then making friends become a problem.
Mm-hmm.
Socializing in the play area, and it starts very young when sharing toys with
Mm-hmm.
others. If that is a problem, then we need to address that before it becomes an issue. And then this lead into the academics, this lead to when they go to college, this leads to when they go to workplaces where a child does not really possess those what we call emotional intelligence.
Mm-hmm.
One of the things that I teach my children every day is that I would rather you have really good emotional intelligence than having all the brain in the world and not really know how to utilize that in a social place,
Mm-hmm.
because you cannot live in an island, by
Right.
yourself. You socialize with other people. And so when a child is delayed and does not possess the skills, it becomes absolutely hard for them to really be able to function properly in our society. And so we have to help them develop the skills. We have to make sure that if we have any sort of mental disorder that we detect, that they are addressed earlier before the impact is really is worse. And so those are some of the impacts that you see, Biftu, that would happen
Mm-hmm.
to a lot of our children if they suffer from one form of mental disorder or another.
Okay, thank you. How would a parent or guardian help their child cope with their mental health disorders? Because it's a child and they might not be able to wrap their mind around what their mental health disorder is. So, do you have any recommendations for parents or guardians?
Yeah. So one of the things that I didn't know this until my children, experienced one form of stress. Um, my kids lost their grandpa. Um,
Mm-hmm.
when they lost their grandpa, my daughter especially, who's now 10, um, she was not very happy. She was very sad, and I just was to me, I just thought, oh, this is gonna end. She's gonna be okay. Little did I know that it's going to go on for a while. And so after a while, I was like, okay, you need to talk to somebody. And so we went and she was able to talk to somebody and she felt a little better. And over time, and now she's doing really well. Um, because, like I said, those adjustments, there was a change.
Mm-hmm.
She was very close to grandpa, and now grandpa is no longer there. And so that
Mm-hmm.
can cause a lot of stress. I mean, you and I would both have stress if we lost somebody we loved. And so a child does not really know how to cope with that. So for
Mm-hmm.
me, I had to learn. And I think the one best thing that you could do as a parent or a guardian is really learn about the illness. So if the doctor has told you, hey, I think your child, or if a therapist has told you, hey, I think your child has depression, you need to learn all about depression. You need to learn about signs of depression. You need to learn about, you need to learn about the illness.
Mm-hmm.
Knowledge is power. And as soon as you learn about this, you will know how to accommodate your child. You will know how to deal with a child who's got issues. Um, and learning continues. There's always new research, new things coming out. Um, I'm not saying that you go on Google, because we have a lot of times where parents would Google something and will come say, "Hey, I saw this on the internet, and I think my daughter has this or my child has this, and I need for you to help." You have to to bring it to us and let us help you dissect some of this information that you learn from social media, you learn from Google and Wikipedia's. We would help you dissect all that, and help you come up with the healthy way of really addressing some of those issues. And so learning about these conditions is very, very important. Ask your child's mental health professional for advice. How do you respond to your child to handle difficult behaviors? I think that's another important thing. A lot of parents sometimes, after they bring a child to us, that's it. They want us to fix the child. They don't, they don't want to talk to us no more. It's just the child. But remember, this is a team effort, and so when you bring a child to us, we have to work together. Continue talking to me. I do schedule sessions for check-in with parents. So if I have a schedule with your child, the first I try to talk to you on a weekly basis, on a regular basis, to tell you about the progress of your child. I also would like for you to tell me how things are going at home. And so just asking me questions. Hey Z, they came in, or she came in, or he came in and just went straight to their room, and that's been going on for a week now. We don't know what's going on, and we can talk about that. We can talk about having space and things of that nature, and how you can transition your child. One of the most important thing I know that really help is having a schedule, being very diligent about it. As a family, this is a time for us. We need to be having breakfast together. We need to eat lunch together. So when your child knows that, even when they're going through some difficult time, if they have structure and a schedule and a routine, they're more likely to follow that routine, especially if the family follows it. And this really helps with stabilizing your child. This really helps with your child really following through with the treatment that we set. Another thing is work with your child's school. Secure necessary support for your child in school. Talk to the teachers. Make a good effort to talk to the mental health providers in the schools too. If we all bring one voice together, the outcomes are amazing. And so you just have to keep doing these things to ensure that your child really has all that they need to be able to be successful. And then explore stress management for yourself too, and how that can help you as a parent or a guardian. You need to find ways that you can help yourself calm. You need to help yourself so that you can help your child and be there for them. And that's very, very important too. So these are some of the ways that you could really help a child cope um, with any form of mental illness.
Okay, thank you. And then just as we're wrapping up here, tell us about NorthPoint's services, so behavioral health. What is there to offer?
Yes, so NorthPoint, like I said, has been in the community in North Minneapolis for many years, over 50 years. And so we keep doing what we do best, providing for people in the north side of Minneapolis and the general population. If you have low insurance or no insurance at all, NorthPoint is the place to be. We have navigators who will help you find insurance. That's just to start. So you come in, and we try to make NorthPoint a one-stop shop. And so, we have the Inc. side that has a lot of things they do. We have the medical side, and then we have the behavioral health side, and we even have optometry if you want to see. So we'll help you with that, and we also have a lab and radiology, and we have a pharmacy right in the house. And so NorthPoint has mental health providers or specialists who perform various mental health services in several settings, including the schools. So we are in conjunction with Minneapolis School District. We provide mental health services to students across Minneapolis. And so we have therapists that go to schools like me, and we provide services there for your child. We also have face-to-face and video and telehealth by the phone at NorthPoint too, for your child, for your convenience. And so you can walk in and sign up. You can call the main number, and NorthPoint will help you connect with a specialist that would help your child. So we do have quite a lot of services. We have groups that we run for children, different ages, experiencing different issues, different problems. So those are some of the things that we do at NorthPoint, and our therapists are specialized. So I'm a child specialist, and we have a few, that are in NorthPoint too. So people that look like you that would serve you, and we're very passionate about what we do. We come to work knowing we're making a difference. And so NorthPoint is really an amazing place to work for me, but also amazing place for you who need any kind of services, be it a family, be it a child, or an individual. this is the place to go for all sorts of services.
Wonderful. Well, thank you to Zadok Nampala, a behavioral health professional here at NorthPoint Health and Wellness Center. We've been talking about children's mental health in conjunction with Children's Mental Health Month. And I hope this has been a really informative interview for everyone listening and watching. So thank you so much, Z. I appreciate it.
No, I appreciate you. Thank you so much.
Yes.
I hope this goes wide and large for a lot of people to see. Thank you so much.
Absolutely.
Yeah,
Absolutely.
I hope you have a great day.
Thank you. Thank you. Thank you for listening to NorthPoint, Making Health Happen. We want you to know that we are here to partner with you, that you can dream, and that you can reach your dream. Please subscribe to our YouTube channel to watch our show in video format. And if you like what you hear, share with a friend. To read more about NorthPoint or find out more information about the COVID-19 vaccine, check us out on the web at northpointhealth.org.
When you walk through the doors, we're here with open arms. We know the times get hard, and we're here to help at NorthPoint. When you're feeling low.
So as we're kind of wrapping up our conversation, I want to ask one more question about racism, discrimination, and that kind of negative factors that might kind of double down and impact a child's mental health. So maybe from your experience, how have you seen racism and discrimination impact a child's mental health?
Yeah. I work in North Minneapolis, predominantly Black communities. First of all, and overall, we know that racism has been recognized as a dominant social determinant of health and has some profound impact on the health of our children, adolescents, and their families. When we have children living in a racist society, this is an ongoing stress. And our children have experienced that more so definitely here in Minneapolis, where we have had so much killing of Black people. Our children have suffered. This was a very sad incident where my own child one time came to me and told me that when I grow up, this is 2 years ago, when I grow up, I don't want to be Black. And I asked her why, and she said that I don't want to be a slave, and that's the 7-year-old mind saying that be a slave. I don't want to be I don't want to be a bad person and be chased by the police. And that is the kind of society that our children have grown up in. And racism, that's exactly what racism is. Black people, Indigenous people, people of color have so much difficulty because as racism continues, there's a lot of stress associated with that. There's a lot of anxiety surrounding that. And so we see a lot of our children having difficulty focusing in school, having increased anxiety, feeling helpless and frustrated. The amount of racism and there's this generational trauma that African Americans in this country have experienced that comes from slavery, and it's years and years of this that has caused so much stress that they feel left out. And when children see their parents struggling, being arrested, not having ability to provide for their families, this impacts them very negatively. And Biftu, this is a topic that needs quite a length of time to talk about. And so I'm just touching on the surface of the iceberg, because this is a very important and dear topic to me, because a lot of our children, when they grow up, seeing violence in their neighborhood, seeing crime, they grow up thinking that is the life.
Right.
And many people don't really understand, Biftu, that there's a lot that goes into this. A lot of people, when they see that, they just like, oh, that's the Black family from North Minneapolis. But you don't understand that there's so much that goes into that. There's so much generational trauma. There's so much atrocity that has been done to people of color that makes them continue living these lives up to today. And if we have to make a change, we have to start with the children. If we have to cut that circle of poverty, we have to start with the children. We have to show them that there's better lives. But that can come unless we fight racism, unless we, because Black people have less access. It starts even with child. Let me just talk for a second, Biftu, about infant mortality rate. Infant mortality rate is way higher in people of color in the United States. It's actually pathetic, so high of any developed nation in the world that America has such a high infant mortality rate of its general population, let alone of the Black people. That now Black people have some of the worst infant mortality rate in the world. And a child is born, and for them to survive the first 1 year of their life, it's almost a miracle. How racism is, how they're treated. And so I actually, Biftu, I don't know if you know this, but I got hired at NorthPoint to work with women. I started with the women's health to help them help their child survive the first year of their life. And this is sad because the children are dying not because there's some kind of virus or some kind of leprosy or something that is in the water. No, basic things: access to healthcare, having transportation, food, clean and safe water, and things of that nature are what are killing our children. Having protection, within the homes, having them grow up with no violence. So racism has caused so much. And I think time and again, we keep asking our leaders, we keep asking our communities to do something to really combat racism, because this is impacting our children's mental health. And it will continue doing that until the day we absolutely phase out racism and really work towards having that equality among us all. And one of the things that we can help our children by is really showing them that we're all human, human nature, that we all share the same ancestors, and that we all mean well for each other. And I think love is one thing that can really take care of a lot of things. Children of color are treated differently in schools too. When a child of color shows certain behaviors, those are considered aggressive, inappropriate. But the same white child does the same behaviors, they're treated differently. So you find black kids, black children kicked out of school. That happens, and then that's a pipeline to prison. This needs to stop. This is something that really need to stop to help our children. We treat them as children. When when they're struggling, we need to step in and help them and support them. I'm sorry, I'm very passionate.
Absolutely.
Yes.
No, this is great. This is wonderful to talk about, because we do need to talk about it. And I think you've given us a lot of information. I think parents and guardians are going to be able to advocate for their children a little bit better. So thank you. And then